I think this is applicable to anybody listening. It's really tapping into your strengths and the things you enjoy.
Hello, amazing people. This is Dov Marcus, director of Healthcare Raw podcast, and I am honored to have an amazing guest on my show today. Her name is Elizabeth Scala. I'm going to ask her to talk about what she's been doing, where she comes from, whatever she wants to tell you about, because this is a patient-centered podcast, and I know that Elizabeth is a patient-centered person. So, Elizabeth, why don't you tell us a little bit about yourself? I'm happy to have you on.
This is awesome, and thank you for having me. I host my own podcast, so I love being on the other side of it, of, being able to answer the questions and talk a little bit more about what I'm up to. And so, yes, I am a registered nurse, and the reason I work primarily with nurses, as you mentioned, is I was actually experiencing my own burnout and was really unhealthy and unhappy in nursing and felt like I couldn't be there for the patient and show up as my very best. And I mean, that's why I went into the field of nursing I went into, which was psychiatric mental health nursing. And I loved listening to people, talking to them, trying to solve problems, troubleshoot. And when I was showing up at work and not doing that, I thought, well, this is not serving the patient. This is not serving anyone. I'm not helpful. So I had to take a step back and take a break. So now the way that I work through the nurse, I work through nurses indirectly with patients. So I don't go hand in hand in direct patient care, but I find that if I'm working with nurses and helping them be happy, healthy, engaged, excited to be there, the very best, then we can provide the best patient care for everyone.
So if you focus on the people who are impacting the subject of healthcare, the patient, if you help those people, then you are actually helping patients.
That's right. I mean, healthcare is a very people-centered place. People are coming to other people with problems. People are coming to other people needing help. People are working together to help them out. So it's all about these interactions. And if we're not feeling, up to our level of potential, if we're not feeling energized, if we're not feeling awake or focused or able to concentrate, if we're just feeling tired and drained and upset, I mean, how are we providing the best? So, yeah, I mean, like I said, I don't work directly with patients and I do miss that. But at the same time, I know that the stuff I do with the nursing population, impacts them working with the patient. So that feels good. That's amazing. And congratulations for your success.
I do see that you're a writer. You've written a number of books. I was looking around on your website. I see that you write books, you do conferences, you're a public speaker. Tell me about how you don't just fall into that. There must have been, a certain point. I mean, you talk about that you were burning out, but to get to the point where you are, where you're speaking in front of crowds and you're motivating them. Tell me more about that journey, because I feel like I'm on something similar. Tell me a little bit more about that.
Yeah, well, it's what I tell everyone. I think this is applicable to anybody listening. It's really tapping into your strengths and the things you enjoy. So when I was a kid, I was a dancer. I took dance lessons for 13 years. The recital, people would be nervous, people would be scared, and I'm ready for them to open the curtain, and I was so excited to be on stage. So being a speaker and getting on a stage in front of a crowd of people, sure, there's adrenaline and some butterflies, but once you're in that present moment, if that's what you love to do, if that's one of your strengths, if you love to tell stories and break things down so people can understand and help them, bridge a gap from where they used to be to where they want to be and have some kind of benefited outcome, it's a lot of fun. So I always tell people, think about your strengths. Not everyone might be a speaker, you might be creative in some other aspect, but look at your strengths. And if that's something you want to do, then you pursue it. And the second thing to say is do one thing at a time. These these speaking events and giving talks internationally and being in big conferences and stuff doesn't happen overnight. So I take one step at a time. I decided that this was what I wanted to do. I got my website set up. I got my talks kind of organized. I sent out materials. I did outreach communications and marketing. I made a lot of telephone calls. And the first year I maybe had 3 or 4 talks. And then every year it grows because you continue to take action and you just take one action at a time.
Fantastic. And you see success. I'm sure you get emails from nurses who say, "Oh my gosh, I was at your conference. It was so cool. I have a new perspective." That must energize you further to continue.
Well, absolutely. That's the reason to do it. After you step off the stage and people are rushing to ask questions or want to purchase the books and talk about and say specifically and a lot of times, again, I tell stories, I try to make things applicable. So I bring up my dog in one of my talks and I talk about how we often treat our pets better than we treat ourselves. We come home from work and we're like, "Hey there, Rusty, you're doing so good. You're such a good boy." And I'm talking about how you're praising your dog. But do we really praise ourselves? So I tell that story. I step off the stage and people come to me, "Well, I have a dog. And what kind of dog do you have? And I think what you said was so important. And I'm going to treat myself, like I treat my dog." So it's true. It's connecting with that person at that one-to-one level, even though you were talking to the whole audience. It's really fun when something clicks, then they'll remember that. And then they'll put that healthy practice into action later when they leave the talk or the conference or whatnot.
Very, very amazing. So within, nurse within, that's your trademark keyword. So I want to talk a little bit about that because you talk with nurses about finding the within, right? Obviously you can be more eloquent on that. Let's relate that to patients because as you know, this is I try to talk directly to my healthcare patients. In fact, while I'm talking with you, I think of someone who survived a stroke who might be listening to this. I think of someone who just had heart surgery, someone who's just going through something that I've never been through and that I'm trying to help them. So tell me about finding for a patient to find strength within.
Sure, that's a great question, and it is really applicable to any human being because I am a holistic nurse as well, practice holistic nursing. I'm part of the American Holistic Nurse Association, and so what that means is approaching patient care, approaching well-being from a mind, body, spirit, energy perspective, the whole person. And when something's out of balance, for example, if a patient presents with some unknown pain, has a pain, but the cause is coming from an unknown source, it may not be only from a physical location. It may be from an emotion or some kind of energy that's stuck inside the physical body, but it's manifesting as pain. Okay. So talking to the patient, it's like, you can really heal yourself internally by coming back to what I talked about earlier, your strengths, your values, the things you really enjoy and love to do. So many of us get thrown off course because we're thinking of what we should be doing, what's best for our family, what we saw on the news or in the public media, and maybe I should do this and I could do that and I have to do this. And those aren't our personal desires, our heartfelt desires. So if we get off course and we're moving away from what we really truly want, we sort of manifest kind of these symptoms within ourselves. So for any particular person, nurse, patient, school teacher, social worker, police officer, whatever, it's really getting back to what you want to do, your authentic self, your values, your qualities, your strengths, and living your life in that way, making choices based on your within. So yeah, it really is applicable to anybody, and that's the essence of what I teach.
So it's not necessarily just, someone is hurting from someone has a wound that's hurting someone. It's a matter of them also looking into the other areas of their life, and maybe something. The first thing that comes to my mind is, well, now I'm not able to go golfing. So you're hurting, and what's really coming out in many cases is the other things surrounding it. Now I can't do this. Now I'm a different person.
Mm-hmm. Yeah.
So that's
Yeah. It can be go through a rehabilitation and have everything fixed. But if we think about what was the cause that got us to that, and what was the cause that got us to that, and going deeper and deeper to that root cause, there's typically, for most experiences, it is linked to some kind of disconnect when you're thrown off your course, when you're thrown off of that course of your passion, what you really desire to do in life, what you're gifted at, what you love, what energizes you. If you're showing up day after day and feeling downtrodden, exhausted, depleted, it's going to take effect over time, and then, slowly get to the place where you have this big wound and you can't go golfing anymore. So I'm talking about, really going back in sort of history and thinking about the root cause of all of this. And again, some people are just not ready to hear that and kind of turn off things like that when I say, or other people teach this too, and you might turn your ears off, and that's okay. We can't, have everyone on board, but just if you're thinking about it, if yourself just listening, just thinking, what is it that I truly, truly want to do? What is it that I truly, truly enjoy, value, love? Am I doing that? Am I connected to those things? And just by having that awareness is like the first step to making any kind of change.
Awareness is the first step to change. So let's talk a little bit about treating versus healing. And this is a conversation. I still practice patient care. In fact, after this interview, I'm going to get in my car and I'm going to drive to a patient's house. I do home care, and I will make that person the center of my life. And what I try to do, and I joke with the patients, I don't get paid for this, is to try to heal you. Okay. So the conventional medicine, okay, the American medicine, big focus on treating the illness, obviously, billable, treating. How can we connect those two things, treating and healing? And this is also, just to clarify, lots of people have different things in mind when you hear the word healing. Let's talk a little bit about that. What comes to mind?
Well, for me, what comes to mind when I hear the word healing is just quality of life, because I actually I do as well work in a nursing role. I'm a research program coordinator, so I don't have direct patient care, but I work with the nurses on evidence-based practice projects, quality improvement projects, research studies, and I go to various nursing departments and talk about these things. And yesterday I was in the Department of Oncology and listening to a physician speak with a group, and we were talking about healing in terms of maybe the outcome is not to end the cancer. Maybe it's just about improving the quality of life. So for me, I think healing is just getting to a place of better quality. It may not mean that illness process is completely gone, but it's increased quality of life. So, okay, well that's, you see, all these topics, and it would be, I like to think into the future. I'm really having a great time talking with you, and I'm sure that our listeners are enjoying this as well. There's just so much to talk about. I had this crazy idea, Elizabeth, that why don't I take some of my nursing skills, such as how I connect with my patients using eye contact and therapeutic touch and being myself, and those most fundamental aspects of nursing, and let me turn that into a program for corporate America. This is how I think. I'm driving down the street and I think crazy. Okay, I think big and I think crazy. So I got in touch with a friend of mine who does this kind of thing, not in healthcare though. He took some kind of obscure idea and he turned it into this corporate motivation thing. So I contacted him. I said, hey, buddy, here's my idea. He says, Dov, it won't sell because corporate America knows that healthcare is screwed up. And I said, thank you, sir. You just gave me more of a reason to do it. So the reason why I mention this to you is that you and I both work within healthcare.
We both work within healthcare. We see the problems, and we're trying to do something about it. I'm trying to formulate a question from this, and I really just kind of wanted to express that, maybe it's a within thing. We're trying to focus on within. When you step outside of yourself and you try to help someone else, such as, if I try to step out and help corporate America, right? That might give me insight into how I can help healthcare itself. Any comments on that?
I think it is a challenge. I believe what you're talking about to me sounds like blending the art and the science of nursing. So as nurses, we have to show up to our clinical jobs, whether it's in a hospital, in the home care setting, in the clinic, outpatient, and et cetera, and provide Western treatments, medications, surgeries, equipment, devices, alarms, bells and whistles, technology. And these things are positive. I mean, they are helping us to live longer, increasing the quality of life, and just allowing for improvements and advancements in health, in our population of health. Okay, I agree. And we can't let go of what you were describing earlier, the eye contact, the therapeutic touch, being present. When you are with a patient, listening to what they have to say, both in words and in body language, because they may be telling you, I'm not anxious, I'm doing good, making jokes about the procedure, but you can look in their eyes and you can sense their energy and they're feeling very nervous. So they may need you to place, their hand upon them and just say, I'm here with you, it's going to be okay. So to me, healthcare, yes, there's a lot of challenges, and some of them are outside of our control as patients, as consumers, and as the providers, thus being nurses. But what we can only do is role model that presence and role model that art so that we practice in a way in the science, using the science, but we practice in a way that has that human connection and brings us back to the essence of nursing and of patient and family-focused care. Awesome.
Okay, so let's talk directly to patients now. Okay, let's just get it out there. Okay, a lot of people are hurting. A lot of people are suffering. What can you, Elizabeth, tell someone who might be feeling right now, gosh, I'm in this crazy world. People are treating me with, as you mentioned, with the tasks, with the IV. They're coming in, they're doing my wounds. I feel lonely. Well, how can you offer some encouragement? I'm putting you on the spot, Elizabeth.
Yeah.
That's okay. Because by the way, while you think about that, this whole project, Healthcare Raw, is all about, it's not all about me, but when I'm doing this, I just try to be myself.
Mm-hmm.
So like my interviews, I just let it flow. So don't, if that's kind of like, what can you, you're right now in front of a person who says, Elizabeth, I feel lonely. What do I do? What can I do?
Well, if someone was saying that to me right now, face to face, I would say, I hear you, and I actually can understand how you feel. For myself, I have felt alone very often as well. I've felt rejected by a lot of people over the course of a lot of things that's happened in my life. I've experienced tragedy, and I can understand how hard it is to lose a loved one to such a situation that is a shock, and you're not even ready for it. So I can understand how you're feeling, and what I can offer is that if you want it to, if you consciously choose to, if you take action to, and if you have the perspective and mindset to do so, it does not have to feel that way. But it's kind of up to you as an individual to consciously make the decision, I'm going to reach out for support. I'm going to change my perspective and say, gosh, I have it pretty hard, but that gentleman in the room next to me has it even worse. I'm going to look at what I can appreciate today. I'm breathing. I'm talking to you. I'm having a conversation. And there are probably some things that I can look at in my life and be grateful for. So those are just the beginnings of what I would get into, and then, continue with conversation to hear their further reactions, questions, probably objections to what I'm saying, and just dialogue around that.
Excellent. Sounds empathetic, truthful, and positive.
That's pretty much how I operate.
Awesome. Okay, so Elizabeth, why don't you tell our listeners how they can find you?
Excellent. Okay, well, my name, ElizabethScala.com. So if you just Google Elizabeth Scala, it comes up all over the place. Elizabeth Scala is my website. All the social media links are there. And I will tell you, even if you're not a nurse, I used to do webinars, monthly conference calls, and lots of content. I had people from all different professions signing up and listening and learning. An IBM person who worked at IBM, a teacher, a person who was in religious work, all different types of jobs, and just saying, wow, the content's really applicable. So even though I speak and write about nursing from within, as we've been discussing here, Dov, it's just the content is applicable to human experience, really.
Okay, well, that's amazing. I'm going to provide the links in the bottom. I called you Scala. You didn't correct me.
That's okay. People call me Scala, Scalia, as if there's an I in it. I've heard it all over the gamut. So as long as you got the Elizabeth straight, I'm happy.
Okay. Well, thank you, Elizabeth. It's been a pleasure talking with you.
Yeah, thank you.
Visit us at healthcareraw.com.